Most sex workers, drug users and the LGBTQ plus community are discriminated against at public health facilities. A survey found 75% of them face discrimination from staff. And this included being judged, having their consent violated and being denied needed treatment. eNCA reporter Hloni Mtimkulu finds out more.
For this Pretoria resident, an awareness about sexuality was there from as early as grade 2. As a child, they were left to navigate the stigma that came from their peers while trying to understand who they were.
I would perceive myself as a girl. I would perceive myself as a girl. I would even pray to God that can we please remove the outer part of the manly me and let me be a girl. There were those certain boys who would stay on the passages to the toilets. Then they would ask, "Rubena Kanti, are you not a girl?"
Years later, it was adults dishing out the stigma, even in the medical setting, while trying to access basic public services from healthcare professionals.
And then when she was busy consulting me, she was examining me. So she used a glove and a fingernail just to examine and to determine the extent of the damage. And then after she was done, she asked me, "What did you put in your anus?" I was like, "What do you mean?" So that was very humiliating. It was humiliating. And I felt stigmatized, to be honest. Yeah. Because let's be honest, hemorrhoids do not only get to people who are gay or LGBTIQ people. Anyone can get them without having anal sex at all.
This story is not unique. The Richize project surveyed nearly 14,000 sex workers, drug users, and members of the LGBTQIA plus community.
I would be a lot more comfortable not talking to an old woman who's from a different generation or an old man with, their religious convictions, because it's one of the things that are imposed on us in the clinic.
At some point, we do need psychology. Each and every one of us, we have been raped. We have been tortured at some point. Where does that go? We are so afraid to go and open up to someone, especially when it comes to a clinic, because you don't know where that story will end up.
The research shows that things may be worsening for the key populations.
It's people taking their own biased beliefs, on other people's lifestyle and who they are, what they identify as. So it's about asking for a bit more accountability, for people to be held accountable.
A representative from the Department of Health gave an assurance that senior managers would be made aware of the report and that they would intensify the training of healthcare workers. Hloni Mtimkulu, Pretoria.